we are supporting women or facilitating women engagement in decision-making levels to be able to push for their agency and also be meaningfully engaged in decision-making. We are also working in this jointly with our partner Care Kenya, and our key focus also is on ensuring that there's a change in terms of discriminatory social norms that hinder women from accessing healthier diets. So we are pushing for creation of awareness and sensitization on the same to ensure that there's access and consumption of healthier diets at a household level. And also for us to ensure that this is going on, or this can be taken up by women, we're also looking at the aspect of empowering women economically to ensure that there's resources available for them to actualize access and consumption of the healthier diets at household level.
I think we've been able to really ensure that we promote inclusivity, especially given that the primary target for this project is women and children. And therefore, I would say from the policy front, we've been able to really champion for women's access to nutritious foods, and basically ensure that at least there's a bit more resilience when it comes to issues of price and climate shocks, because most of the time they are faced with a lot of issues. A lot of our county governments have come up with policies, and in this project we decided to really pick 3 critical policies that speaks to the needs of women of reproductive age. One is looking at county nutrition action plans, and this nutrition action plans, which is a policy framework that is really aimed at offering a package of interventions to women and children. And I believe it's been very helpful looking at what we've just done in Nyandarua, where we didn't have a policy in place. We've really been able to package and work with them to really come up with that. And so for the first time, at least, we have been working closely with the CARE to really also really kind of bring forward some of the lived experiences and what I would call the voices of women into the conversations we're having with the county governments. So I would be very happy to say that we really are not just there to talk on behalf of the women, but also allowing them through the community structures to really bring forth some of their experiences in accessing nutrition service. There's another policy called the Agriculture Sector Transformation and Growth Strategy, which is very useful when it comes to issues of agriculture and also productivity in the country. And knowing very well that most of the smallholder farmers are women, and of course, really we needed to really strengthen support and opportunities for women, and I would say some of these farmers to really access services and inputs that would also ensure there is a bit more inclusivity. We have been very particular and asked the government to really make much more effort to ensure that a lot of our farmers are enlisted, and especially even for women farmers who would benefit from some of the subsidies. And that's the reason why GAIN was also very deliberate when it comes to social protection, because we know vulnerabilities are still there, in as much as we are aware that there are efforts by communities to be food secure. There are still many households, and especially for women and children, who are still very vulnerable, who are going without food, facing acute malnutrition cases, and so much that we really need to really help them really benefit from some of the social protection packages that are available.
So for us to inspire inclusion, I call upon the government and the respective decision makers and policy makers to allocate more funds or budgets or invest in gender-related nutrition policies and policy aspects that relate to healthier diets, even at community level.
So happy International Women's Day. All the best for our women and children.
Happy International Women's Day. Let's inspire inclusion.